Hello, everyone. My name's Keith Greenhalf. We're going to be focusing on ADHD this week.
I took a different approach with my presentation. I wanted to try something visually engaging, so I did a narrated animation. Um, it was probably more ambitious than I initially thought. I really do hope you enjoy it, and I'm interested to hear the feedback. Thank you.
Okay, so attention can be broken down into two categories. That is, we have the ability to direct and sustain our attention. Directing our attention refers to the ability to select relevant information to pay attention to while ignoring information that is non-relevant. An example would be attending to the teacher while they start talking, relevant information. However, if you become distracted by the birds outside, non-relevant information, you miss the instructions. Sustained attention represents the ability to focus on something for an extended amount of time. This means you have the ability to direct your attention for as long as it takes to complete a task or event. In the example, you could not pay attention long enough to get the information you need, so essentially you left the class before the instructions were complete. Individuals with ADHD typically have more success sustaining and directing attention while they're doing something entertaining to them. If you think about the example before and then think about experiences with someone with ADHD and perhaps their ability to remember what happens in a movie or a video game, just as some examples. One of the most important things about our attention is that it's selective. That is, we've always got this sensory input going into our limbic system of our brain, but we only consciously perceive a small set of it. So selective attention really has two traits. It improves your ability to think about what you're focused on, while it interferes with your ability to think about what you're not focused on. In this example, if you focus your attention on one conversation, your chances of understanding it increase, but your chances of understanding a comment from the other conversation decrease. Our attention can be focused in two different ways: by an internal cognitive process, endogenous attention, or by external events, exogenous attention. Remember the teacher? When we focus our attention on her because we are attempting to listen, this is endogenous attention. Remember the bird? When we're distracted by something external, or our attention is drawn by an external stimuli, this is called exogenous attention. Endogenous attention is thought to be mediated from a top-down approach in the brain. That is, it goes from higher thinking neural mechanisms to lower reacting neural mechanisms. Exogenous attention, however, is thought to be mediated by a bottom-up approach in the brain. That is, it goes from lower reacting neural mechanisms to higher thinking levels. Eye movements play an important role in our ability to attend visually, but it's important to realize that our visual attention can actually be shifted without shifting the direction of our visual focus. Here's a neat activity from the textbook that explains covert and overt visual attention. Try and focus on the plus sign in the middle, and then without shifting your eyes, see if you can focus your attention to the different letters. You should be able to do it. Another fun thing to think about is this cocktail party phenomenon. When it comes to selective attention, if you're at a cocktail party, you have the ability to focus intently on one conversation while ignoring all of the other conversations that are going on around you. However, if someone is to mention your name in one of the other conversations, we immediately gain access to that conversation in our consciousness. This phenomenon suggests that our brain can block from our conscious awareness the stimuli except that what we're interested in. All the while, your brain is still unconsciously monitoring the blocked out stimuli just in case something comes up that requires our attention.
I have my own attention phenomenon that I will coin the parent phenomenon. I was in the middle of an IEP meeting during a busy book fair day at the school. My attention was directly focused on the meeting, while there was a number of noisy preschoolers and kids in the hall. In an instant, my attention was pulled away from the meeting because I was aware of the sound of my daughter's voice, who heard herself down the hall in the library. Out of all the noises and clatter, I could clearly distinguish the cry of my own daughter. I hope you enjoyed the animation explaining how our attention works. We'll now go further into the slides exploring attention disorders that fall into the category of ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, affects children and adolescents, but can also continue into adulthood. ADHD is the most common psychological disorder in children. Children with ADHD may be hyperactive and unable to control their impulses, or they may have trouble paying attention. These behaviors interfere with school and home life. The percent of children estimated to have ADHD has changed over time and can vary how it's been measured. The American Psychiatric Association states that in the DSM-5 that 5% of children have ADHD. According to the CDC, boys are 3 times more likely to receive an ADHD diagnosis than girls. It is thought that girls are not necessarily less susceptible to the disorder. Instead, ADHD symptoms likely present differently and often interfere less with school and home life for girls.
Adult ADHD is the title given to people when the disorder persists into adulthood or if someone is diagnosed with ADHD as an adult. Symptoms for adults may include having trouble managing time, staying organized, setting goals, and keeping a job. They are also more likely to have problems with relationships, self-esteem, and addiction. According to the CDC, there are 3 types of ADHD. The first I'll talk about is the inattentive type. Someone will find it difficult to organize or finish a task, thus struggle to pay attention to details and find it difficult to follow instructions or conversations. This type of person with ADHD is often characterized as a daydreamer or easily forgetful or staring off into space.
Hyperactive or impulsive type. Someone here will have trouble keeping still. They fidget and talk a lot. Children are often continually jumping, running, or climbing. They might interrupt others, grab things, or blurt out. They have difficulty waiting and find it hard to listen to instructions. They are often clumsy and more prone to injury and accidents. The third type is a combined type. So this is a person whose symptoms include all of those inattentive and hyperactive. And the symptoms are usually equally predominant. They struggle with both focus and impulse. We know that attention has to do with how our brain works with sensory input. Sensory input all comes through the limbic system, primarily through the amygdala and the thalamus, except for smell, which is received by the olfactory bulb. The job of the limbic system is really to respond in a way to keep us alive. It can fight, flight, or freeze very well, but aside from that, it doesn't play a great role in thinking about what the sensory input is. Thinking and attending in a meaningful way requires the cerebral cortex. Most importantly in our cerebral cortex is a part of our brain called the prefrontal cortex. This part of our brain does the best thinking and decision making and is responsible for executive function. It is well documented that the prefrontal cortex isn't fully developed until around the age of 25 or even later for some, typically longer for males than females. The prefrontal cortex is the part of the brain that helps us prevent impulses and to plan and organize our behavior to reach a goal. For this reason, I'm always hesitant around very young children being diagnosed with ADHD. Brain development and attention are closely linked. A baby doesn't think about sensory input, it just reacts. This is why they scream in terror every time the vacuum cleaner is on. We have to be careful about our expectations of attention before we are certain of the developmental readiness of that child. When you hear the term ADHD, I'm sure you automatically start thinking about medication. Medication is considered a very effective tool in helping those with ADHD. In general, stimulant drugs affect the central nervous system. It can be seen by things like increased heart rate and blood pressure. The helpful effect of stimulants for those with ADHD are increasing activity, alertness, and increases in thinking process. Most people have heard of the common stimulants used like Adderall, Ritalin, and Concerta. Stimulants are by far the most commonly used drug to treat ADHD. Roughly 80% of school-age children with ADHD who are treated with medication receive some stimulant drug. There are many misconceptions about the use of stimulants for treating children with ADHD. The concern comes from the chemical makeup of these stimulants being very similar to cocaine or amphetamines, and thus they have the potential to be addictive. However, stimulants used for treatment of ADHD are the most researched and safest stimulants to provide children. They also don't contain any harmful impurities. The proper dosage is considered safer than giving a child a cup of caffeinated tea. About 17% of all children with ADHD treated with medication receive a pharmacological agent other than a stimulant. Typically, other agents are used either when children do not respond to stimulant treatment or when concurrent psychological, emotional, or behavioral problems are present. Antidepressants differ in their effectiveness for treating ADHD. None are as effective as stimulants for treating the attentional and cognitive symptoms, but they can help reduce the impulsive and hyperactive behavior. Tricyclic antidepressants have well demonstrated effectiveness in treating behavioral symptoms. Desipramine should be avoided because of the concerns raised by the sudden and unexplained deaths of 4 children who were treated with it. At least 2 drugs that are primarily used for managing high blood pressure have been shown to be effective in some cases in the management of ADHD in children. Again, these likely would only be explored by a physician if there was no response or an adverse effect of a stimulant. Some studies have investigated stimulant use in preschool children. The results of these studies generally show that the drug is not as effective for the very young. There is also concern for safety using medication with ADHD preschoolers. Information is lacking on how the use of stimulants and other drugs may impact the development of the nervous system. Unless there is an extreme concern with behavior and attention, medication should be explored later in the child's development. The use of psychoactive medication, or its combination with behavioral interventions, has been shown consistently to be the most effective approach to managing ADHD. The manner in which the drug used, however, is critical to optimize effectiveness and minimize side effects. Especially valuable is the regular input of teachers and parents. New research in neuroscience is revealing how brain chemicals can help us pay attention. It all has to do with how our neurons respond to one another. Alex Thiel, professor of visual neuroscience, explains. When you communicate with others, you can make yourself better heard by speaking louder or by speaking more clearly. Neurons appear to do similar things when we're paying attention. They send their message more intensely to their partners, which compares to speaking louder. But more importantly, they also increase the fidelity of their message, which compares to speaking more clearly. The team reveals that the quality of the response is altered using glutamine coupling to NMDA receptors, a molecular device that mediates communication between neurons. This research has the potential to give insights into conditions such as schizophrenia, Alzheimer's disease, and of course ADHD. We may very well see a different form of treatment in the future. Another recent study suggests that the brain actively suppresses certain signals to avoid distraction. This shows our ability to focus on an object is only part of the equation. The discovery of this anti-distraction system could have significant implications for psychological disorders related to attention, including ADHD. Instead of working on trying to focus harder, we might benefit from suppressing distractions instead. Well, that's all. Again, thank you so much for listening, and please let me know what you think and post your questions.